Hello, everyone. Welcome to our second session in our summer welcome series. I'm Erin McNabb, an Associate Director in the Office of Alumni and Parent Relations and proud member of the class of 2006. We thank you for attending today's event, and I want to personally welcome you all to the MUD community. This talk is being recorded and will be available on the parents' website as soon as we can upload it. And all attendees and registrants will receive a follow-up email with the recording and any links discussed in today's event. So please feel free to type your questions in the Q&A box, and we'll try to get through as many as we can after the presentation. Just a reminder, because there are more events in the Summer Welcome Series, if you submit a question that I think will better be answered in a future event, I'll save it and pass it along to the future panelists. So just to be clear, I'm not ignoring your questions. I just want to make sure that it is properly addressed. So today we will focus on health and wellness topics. Our panel is full of speakers covering various aspects of our health and wellness support services at MUD and the undergraduate Claremont colleges. So we'll jump right into our presentation, and our panelists will introduce themselves as we go along. So let's get started, and I will hand it over to you, Kim, first. Let me just get this presentation going. Does that look good?
Looks great. Good morning, everyone. And I also add my welcome to the MUD community. My name is Kim Nycannon. I am the Executive Assistant to the Vice President of Student Affairs, Dean of Students, Dr. Marco Valenzuela. And in that role, one of my many jobs is I serve as the Health Insurance Administrator for the college. I can be reached at my personal email, which is here on the screen and also in my name description on my Zoom box, or I can alternately be reached at the Dean of Students email address. While I am not the Dean of Students, I do monitor that email address. Health insurance is mandatory for all students at Harvey Mudd. The majority of students do opt to keep their health insurance from home. However, if you need to submit a waiver, you're going to go to this website, and Erin is going to drop the link into the chat. That website not only has the insurance waiver portal, it also has all kinds of links and information to what the insurance covered. It is a national plan. It's Aetna insurance. So if you are interested and you think you want to opt in and have your student be covered by the student health insurance, I invite you to go to that website. All kinds of great information, the plan description and what is covered, what is not covered is on there. Student Health Services here in Claremont is an in-network provider for SHIP students and can refer to specialists. I do recommend that your student if they're going to enroll in SHIP, set up a point of contact now before they don't feel well or are in need and need to see a physician. It's much better to have that, know what you're doing before you need it. And next slide.
Sorry, Kim, someone is saying that they can't see the loaded presentation, and I wanted just to check that multiple panelists are able to see this. You guys are all fine. So potentially it is your internet. If it is just loading, you can always leave the webinar and come back and try it again. So I want to make sure that the audience is seeing it okay. So thank you. Go ahead, Kim.
And for students that are going to continue to use their insurance from home, and like I mentioned a moment ago, about 70% of our students do waive SHIP and can maintain coverage from their home health insurance. I recommend that you find a point of contact by searching for providers in Claremont's zip code 91711. So that your student knows who they're going to see if they need to see a medical care provider when they're in Claremont. Important to actually make contact with the office and not just kind of look at the list of providers to make sure that they are accepting new patients if that need arises. And again, I really encourage you to do this before your student arrives in Claremont and they're not feeling well, and it makes it harder to do all kinds of things when you're not feeling well. I think the next slide we go to Dean Michelle.
Hello, everyone, and welcome again to the Harvey Mudd community. My name is Michelle Harrison, and I'm the Associate Dean of Health and Wellness at Harvey Mudd College. I'm going to talk a little bit about HMC COVID protocols, and please know that we sent an email yesterday giving a greater detail regarding how we're going to manage it this year. But just as always, we are really rooted in our mission when it comes to health and safety of faculty, staff, as well as our students. And we're really hoping to create an environment where it can be safe. So I just want to review a couple of bullet points relating to how we're going to manage COVID this year, as it is slightly different as in years past. So first, all students who will be moving into the residence halls will be required to submit proof of a negative COVID test taken no more than 72 hours before arrival to campus. So within 3 days of arriving, we need a negative test. I think this year we're going to be accepting PCRs as well as rapids. Just make sure that you have those tests scheduled or those resources available so that you can have the result to submit to us in advance. It's going to make the move-in process so much easier. Number 2 is that we're going to require students to test twice a week for the first 2 weeks of classes. And the hope here is that we can really establish a safe baseline and make sure that we're catching any students who may have gotten sick on their way to campus, and really create a safe container moving forward. After those first 2 weeks of classes, testing is not going to be required. Students will still have access to tests, particularly if they think that they've been exposed or even if they have symptoms. Those tests are going to be administered through Student Health Services, which is our central resource in the Trinkwada building. Unless a student has received an approved exemption, all students are going to be required to be fully vaccinated and boosted against COVID-19. So right now there is a booster requirement to be fully vaccinated. In the future, if they add another booster or if that changes, we'll expect students to meet those requirements. Again, unless they have a prior exemption. And then finally, we're pivoting to becoming a mask-friendly campus. So this means that medical grade face coverings can be worn by anyone at any time, but they're not going to be universally required. And the last thing that I'll say about all of these protocols is that just like everything else throughout the last few years, they are always in flux. So something could change based on like numbers, based on what's happening on our campus personally, or based on what LA County Public Health decides to do. We always try to be in accordance with their guidelines as much as possible.
Thanks, Michelle. And just because we got an onslaught of questions kind of very specifically
Sure.
about the testing, we'll talk about it later, I promise as well. So a lot of people are asking about like the rapid test. So can like technically they bring a rapid test, like a what is it called, antigen test with them, take it that morning before they move in and show that? Is that what you're talking about? Or
Yes, yep, they can do that, or if they get a PCR test like a few days before, as long as it's within 72 hours. Yep.
Great. All right, moving along.
All right. Good morning, everyone. Thanks transitioning over to myself. I'm Dr. Pratik Jindal. I use he, him pronouns. I'm the Assistant Vice President for Health and Wellness with the Claremont College's services. I do oversee student health services. So I'd like to share a few slides about what student health services are and what kind of services we provide. As Michelle mentioned, we are the central health facility on campus for all the colleges. The address and location, phone number, and other ways to get a hold of us are listed there, as well as our website, where there's lots more information. The hours were as well on that slide. It's Monday through Friday, basically 8 to 5. We do close for lunch, and there's that. Okay, next slide. So what can we encounter at Student Health Services? So we have physicians, nurse practitioners, nurses, as well as medical assistants, receptionists, and administrators to support all of those providers. And really what we're looking to create is a healthy and safe environment for all of our students on campus. The health center really is geared towards the students. It's a student health center, and so we don't see or make appointments for faculty, staff, or family members. Next slide. So a variety of services. We have students who have pre-existing health conditions that transfer their care here. And as Kim was mentioning, if your student does have some chronic health issues, you probably do want to look around and contact specialists in the local area to make sure that there is continuity for your student's special condition. And also, it wouldn't hurt to reach out to Student Health Services to kind of coordinate a transfer of care, so we make sure that your student is well cared for. But apart from that, from our everybody else, and even for everyone, the acute conditions that come up, people coming up with coughs and colds and strep throats and asthma exacerbations and things like that, they're definitely more than welcome to call Student Health or walk in and be seen. We do physicals and preventive medicine, travel exams, to study abroad. They need to go to some countries. Maybe they need special vaccines or other kind of guidance on preventing malaria, things of that nature. So we do consultations for those. Of course, if they hurt themselves, they're riding their skateboard, scooter, they fall off, they're horsing around, things happen. So we have ability to care for their injuries and wounds. Sexual health visits, including pap smears if needed, contraception, emergency contraception, all of those services are available. STD, STI testing and evaluation and counseling and prevention. We do have the ability to do some x-rays, so most injuries and things can be evaluated on site. We can draw labs and send it out to our lab partner. So if the provider does feel that they need labs for your student, we can do those. And then we do keep a small dispensary on site as well. So if your student does need some sort of medication, a cream or just an antibiotic, or the most common birth controls, so common versions of each of those medications we do keep on site. That your student can walk out with. We can certainly still send a prescription to a local pharmacy if they would rather use their pharmacy benefits through their insurance, but many students find it very convenient to just pick it up at Student Health before they leave. In regards to pharmacy, there is one in the Claremont Village, which is within walking distance. It's called Hendricks Pharmacy. So they do serve a lot of our students, and there are other pharmacies at slightly greater distance, but it's really whatever's convenient for your student and what they prefer to have. Next slide. So in regards to what kind of costs your students can anticipate for using Student Health, we don't have any costs associated or fees for scheduled appointments. So just to come in and see a provider and talk to a provider, there's absolutely no cost. That does not matter whether you're on SHIP. It doesn't matter if you're on your home insurance. To come in and see a provider, to make an appointment and come see a provider at Student Health. And this is one of the most commonly misconstrued things. I didn't take SHIP, so I can't use Student Health. That is absolutely not true. Everyone can use Student Health regardless of what insurance they have and where they're coming from. Again, there's absolutely no appointment, no billing done to see a provider at Student Health. Now, if they miss an appointment, there is a missed appointment charge. There are some nominal fees here and there. Sports physicals, so they're kind of listed, study abroad physicals. Now, while seeing the provider is completely no charge, if there are additional tests that need to be done, so if an x-ray needs to be done, a urine test or throat swab or any kind of medications, injections, if they do decide to use our dispensary to pick up their medication rather than go out in the community to a pharmacy, there will be some nominal charges for those. And we have a price list and we discuss those with your student well ahead of time before they incur any charges for that. We don't bill insurance. I think we have that at a future slide, but basically the point on this slide is just know that your student does not have to pay at the time of their visit. So, they can come in, receive whatever services are needed. They may accrue some charges. They will be given a statement which they can submit to their insurance for reimbursement, and it will stay on kind of their account, on their student account and they have time to pay it off. So it's not necessary that they have to have that money on the spot, or you have to somehow Zelle it to them or Venmo it to them or get it to them right then and there. There's many ways they can pay off their account, which is through cash, Claremont Cash, checks, credit cards, etc. Okay, next slide. So this talks a little bit more about the health insurance piece, I think that Kim had introduced. So we do not bill insurance companies. So, the SHIP insurance that we have, which is through Aetna, that particular product, yes, we are in network because, we've gotten that plan for our students. So it is actually a very seamless process if your student's on the SHIP plan for them to get reimbursed. It pretty much covers everything that we do at Student Health, right? X-rays, labs, medications. They have actually very good coverage for your students' needs on campus. So that's really the most seamless thing. If they do decide to stay on their home plan or your own personal plan, we will give them a walkout statement of what charges they may have accrued. And then it would be up to them to submit it back to your insurance. And keep in mind, if you have HMO insurance, that probably won't cover. If you have a PPO insurance, will probably be under your out-of-network benefits. So just, in full disclosure, just keep all of those things in mind when evaluating whether or not to keep your private insurance for your child or whether to supplement or buy or get them onto the SHIP insurance instead, right? But either way, the students don't have to pay at the time. They will have to eventually pay for their charges, but make sure your student is not afraid to get care just because they're afraid to get a charge, okay? Next slide. Medical information is confidential, and so it is protected by privacy laws and FERPA laws. So unfortunately, we're not going to be able to discuss their medical health and what they're seeking care for with parents or with other family members, or even the campus itself, really. So the student health is part of the central service organization. So it's not like when they come in, we call their dean and say, hey, guess what? Your student was seen for such and such item. So all services of student health are confidential, and the only way that we would share and disclose it would be with your student's consent. Of course, there are some exceptions as required by law. Next slide. We also have a health portal. So on the health portal, they can use their same login that they use for their campus, and that's where they can look up lab results, they can check their financial account and what kind of charges they've accrued, they can review their immunization records. They can also message back and forth with our student health services staff, all in a very secure, compliant portal. All right. Additionally, so again, we're Monday through Friday, 8 to 5. We do have a telehealth service that we offer all students at the Claremont colleges. So that's available to your student 24/7. It is on demand, no cost. They will receive information about it. The service is called 7C Health. And they basically, they can go to the website, or they have an app. And all this information is on our student health website as well. They can do either a phone visit or a video visit with a provider, basically whenever they feel. So even if during the day they're like, oh, I don't want to walk all the way to the student health services, they can be in their room or wherever they're at and get a consultation with a provider on demand. Certainly after hours, weekends, they can utilize this service as well. So apart from just kind of calling up a doctor on demand, they can also do scheduled visits. So if they see someone and they say, hey, I want to see you back in 3 days for your cough, make sure you're better, they can schedule those follow-up visits as well. And then there's also on-demand counseling and scheduled counseling. So if your student's having a rough time, stress is getting to them, they're just feeling down, they want somebody to talk to, they do have on-demand counseling available. That is unlimited. And then, of course, they can schedule follow-up counseling visits. Those are capped at 12 sessions per year. Okay. In a case of an emergency, Campus Safety does help coordinate a lot of our emergency responses on campus, and the phone number is listed there. Certainly 911 is always available nationally. We do have local urgent care. It's about a mile and a half up the street, up on Claremont Boulevard. So it's the Pomona Valley Health Center urgent care. And then there are 2 local hospitals, probably about 10 to 15 minutes, depending on lights and traffic, Pomona Valley Hospital, and San Antonio Regional Hospital. Those are all available in the local area. And back to you, Michelle.
So I've already introduced myself, but just a reminder, Michelle Harrison, Associate Dean of Health and Wellness. And I wanted to talk just a little bit about our programming, because a lot of what we do is preventative mental health, preventative wellness, and part of what I do at the institution. So I actually live on campus. I live in Drinkward Residence Hall for anyone who has students moving in. I'm on the first floor. I also serve as part of the on-call rotation. So 24/7, we have somebody at the institution with an on-call phone in case emergencies happen. And then I'm also part of our care team, which is a multidisciplinary team of individuals at the college who really work to make sure that students' needs are being met, both academically and on the emotional wellness side. Another part of what we do is we supervise peer health educators, which are our students who go out and do health education programming. That's primarily because peer-to-peer education has been proven time and time again to be the gold standard for how we kind of continue to influence students in a positive direction. That programming occurs around 9 dimensions of wellness, which I definitely encourage you all to check our website and read about them. And then another large part of what we do is case management, advocacy, and support. So kind of working with our central resources to make sure students are getting the care that they need, directing them towards resources as appropriate, and then making sure that they're linked in and really getting the support that they need. Here's our 9 dimensions on the right, if you want to just kind of check through them. The idea here is that having balance in all dimensions is going to lead to the happiest, best students and the best outcomes. Some of the programming that my office does is Project Connect, which is a program that really seeks to help students form connections, learn how to build relationships, learn how to talk with their peers. I lead an emotional intelligence seminar, which is rooted in DBT therapy, but it really works with students on emotion regulation, distress tolerance, and some of those interpersonal effectiveness skills. So helping them learn how to deal with conflict or ask for things or say no to things. We do cooking and baking classes, yoga and meditation, lots of workshops on mental health and well-being. And then a program that we're launching and really excited about this year is mental health first aid. So working to ensure that our whole community from faculty, staff, and students are sort of trained in mental health first aid and the basics of how to intervene and how to get students connected to resources when they need them.
Hi, I'm Dr. Carrie Park. I'm one of the senior staff psychologists at Monsoor Counseling and Psychological Services. You'll also hear it referred to as MCAPS. We are located in the same building on campus as the Student Health Center. That's the Tranquata Student Services building. You see the address, phone number, website listed there. And so our office, we offer brief assessment appointments. And so part of that process is we meet for a brief meeting with students and kind of help determine their needs. And so a short-term goal-oriented therapy is a good fit. We're getting them scheduled with one of our therapists. We also assist with referrals to the community or other departments. And so that's something we can assist with if more long-term or some kind of specialized treatment is needed. We offer group therapy. So once we get our schedule up for the fall, that'll be up on the website of the groups that are being offered. We also have psychiatrists on staff. So in our office, the psychiatrists are the ones that prescribe medication. So we can assist with getting them connected to psychiatry. We offer crisis and on-call services, meaning that you can call our phone number at any time. So if it's after hours, students will be connected to an on-call therapist to speak with. We also do outreach programming and workshops. So you'll see us a lot with orientation. We do a lot of programming. We also do offer workshops throughout the year. Again, some are just through our center and some are different departments asking us to provide a certain training. We also offer consultation to students, staff, and faculty, meaning if somebody's concerned about somebody else and they're just not sure kind of what to do or how to handle a situation. Sometimes students will say, I'm concerned about a friend, so they can just consult with us. And so sometimes that's a way we can offer support. As far as how our services are going to be offered, most likely we're going to be continuing to offer services via telehealth, primarily video. We also, offer audio. we're still sort of, again, with the school, sort of depending on what CDC guidelines are of, we were offering face-to-face masks in more urgent and emergency situations, but we'll be determining as the year goes on kind of what our services look like. As the same as student health, our services are confidential, so that treatment record is separate from all academic files, so that information can't be shared with parent, anyone on or off campus. I know sometimes people have concerns. So students can always sign a release form if they want us to communicate with someone, whether that's a parent, whether that's professor, or a physician. And so just know it's all confidential. Students, it's always up to them. If there's a reason it would be helpful to share information, they can consent for information to be shared. And there's additional services, again, same as through for health services. There was 7C Health, the website's there, and that offers the 24/7 medical and mental telehealth. So that's an additional service beyond our office. There's no cost, students can register. Also through that CHIP, the Aetna, there is also additional telehealth counseling services available. And just to backtrack, there's no fee for the services when students use our center. There's no fee for any of those appointments. The only time a fee would be involved is, say they see the psychiatrist and are prescribed medication and they're filling that prescription. But for the appointments through our center, there's no fee.
All right, thank you guys. I'm gonna stop sharing the presentation now. Our panelists have been answering questions in the Q&A, but I am going to go through them again, just for those who haven't been reading along. So early on, there were some questions about the negative test to move into campus, and a parent asked how would they show that negative test when they come? So Michelle, can you talk a little bit more about that?
Yeah, so our first preference is that students submit their results through the portal. We sent a link to the portal in an email that came out yesterday, and I will, as soon as I'm done talking, grab it and put it in the chat for everyone. So that's an opportunity for students to submit both negative and positive tests. There was also a question about natural immunity if somebody has tested positive within like a certain amount of time. And so the policy that we're going to be using this year is that if your student tests positive after May 30th, 2022, so almost 90 days within move-in, they don't have to submit a negative test, but they do have to submit proof of a positive test. This can be done through the exact same portal. So the portal is the preference. However, if you arrive to campus and you're taking your test right then and there, you can upload it to the portal at that moment. We're also going to have residence life staff as well as DSA staff posted around campus that can kind of help you navigate that.
Great. And kind of related to that question about the natural immunity, they mentioned that they were vaccinated but not boosted. So I believe, as Kim said, the booster is required, correct? Whether or not you have had COVID in the last 90 days, that's not related. The booster is required to be on campus.
Yes, whatever the CDC is considering fully vaccinated at the time, which right now is having your 2 rounds as well as a booster, is going to be required. If they add an additional booster or anything else, we will also be requiring that.
All right.
Just to clarify, actually, the CDC's definition of up to date. So staying up to date.
Oh, thank you. Up to date.
Right. Yeah, and I can throw a link into the chat. I'll bring that up real quick.
Thanks, Pratik. Someone else asked while you were presenting, Pratik, about antibiotics and where they can get them. So they wanted to know about that pharmacy on campus, which you very specifically mentioned that you have a small pharmacy on campus for some traditional medications. But can you go into more depth about specifically like antibiotic needs?
Correct. Actually, we don't have a pharmacy on campus.
Right.
We have a dispensary on campus.
A dispensary, so sorry.
There is a legal distinction apparently, so yes. So we have a small dispensary where we keep some of the more commonly utilized medications available for students. So yeah, there's no pharmacy, but they can avail some of the most common, birth control, antibiotics, creams, etc. So we have that. But there is pharmacy locally in the area. If we can, maybe we can put in the Hendricks Pharmacy information so folks can check that out. I think that's one that our students really like. And I think, if I'm not mistaken, Hendricks also delivers to campus.
Oh, how fancy.
Yeah.
All right, I'm putting Hendricks Pharmacy website in the chat. And then someone asked about urgent care at SHS specifically. And then there's a follow-up as well about whether the local urgent care is in network. So Pratik, can you talk a little bit more about urgent care?
Yeah, give me 1 second. I'm just getting that up-to-date link. So put that into the chat so we can finish that topic.
All the links.
Exactly. All right. And that's the CDC and their definition of how to stay up to date. I'm sorry, the question again.
Urgent
was,
care. Urgent care.
Yes. So yeah, we don't have a separate urgent care. We just have our student health clinic, which is, again, as I mentioned, primarily a appointment-based clinic. If your student does not have an appointment or has an urgent need that they want to be evaluated for, first thing is, I mean, if it's like a cough, cold, etc., I would still recommend that they call the student health. We have a lot of same-day appointments. We purposely reserve those so they can get an appointment for come on in right now, come on in a couple of hours, and we'll see you. And those, again, have absolutely no charge. We do accommodate walk-ins as best as possible, if depending on what's going on, what the situation is, and what availability we have with the providers. There is a small fee for walk-in for non-scheduled appointments. I think it's like $15 or something like that. But no, we don't have a separate, just, come in urgent care, wait, and we'll call you one by one and see you. So it will still be fit into our normal appointment system. If we're not able to accommodate your student, then they still can use the 24/7 telehealth service that both Carrie and I have mentioned, or they can go to that urgent care up the street, or any other urgent care, frankly, but that's the closest one to campus. In regards to being in network, I don't want to misspeak. I'm sure that Aetna, Ship, Kim, do they have a site where they can check which providers? I want to say they probably are in network because I've heard of a lot of students utilizing it, but I don't want to misspeak and to that. Kim, do you have any insight on that?
Yeah, I answered in the Q&A that I'm unsure if that particular provider is in network. I can be in touch with Aetna and double check with them, and then ask Erin when she sends out the update to this to include that answer. However, on the link that I provided at the very beginning of this, takes you to the Gallagher, the waiver portal, but also that website, there's a plan summary on that website. You can go in and search for providers. So if you need to know before Monday if that urgent care is in network, you will probably, under the Find a Doctor tab on the website, you could probably answer the question. But I will be in touch with them directly just to make sure that we're giving you the most accurate information.
All right, thanks, Kim. So someone asked, if a student comes to campus with not the SHIP insurance and wants to take advantage of the mental health counseling, is there a fee? Carrie, maybe you can clarify this. And then is it advisable to get the additional student insurance to avoid fees? It's kind of a follow-up question.
So for the counseling center, there's no fees at the counseling center. So to see one of the therapists, see a psychiatrist, any of our services, there's no fee for any of our services. It doesn't matter what insurance you have or if you don't have insurance. The only time insurance is involved is if we're giving referrals, say more long-term, a specialized treatment program, something like that. And then we would work with students to give them referrals if they want someone that takes their insurance. It doesn't matter. We'll ask them what insurance they have and help connect them to a provider that accepts their insurance. But for students to be seen at Monsour Counseling Center, we have no fee. It doesn't matter what insurance you have.
Great. And does anyone want to advise about the get additional student insurance to avoid fees? I don't know if that is very specifically to like, is there any advantage to having both of those, like having SHIP and your home insurance at the same time?
Here's my understanding, and of course, Dr. Jindal can join in. In my experience, students that have carried 2 health insurance policies, sometimes the health insurance provider, they get into a little bit of a contest as to who's going to pay for the claim. So I would definitely check with your own personal insurance. Go to your own home insurance website, search for providers in Claremont. Make sure that your student is going to have good coverage here before you waive out. You don't want to have your student not adequately insured if they need it. Yeah, I would check with your home provider, because sometimes insurance companies really get into it with each other, and that's not something you want your student or yourself to have to negotiate.
And I imagine every policy is a little different, so it's hard for us to give advice very broadly. So,
Yes, thank you.
So someone asks, what about the parents who are helping move in? Will they be required to show a negative test? They will not. They are guests to this campus and they are not required to show a negative test. However, part of registration for parent orientation, which I recommend you all register to be part of parent orientation, which includes move-in, lunch, and some programming in the afternoon, requires that you attest to being fully vaccinated or showing a negative or taking a COVID test 72 hours before arriving on campus and being negative. So we are hoping that all of our parents come safely to campus, is to keep all of our students, faculty, and staff safe while you are moving your student in, but we will not be checking any tests while you are moving your student in. You will just be around that one day. Most of our programming is outdoors for safety, but we will ask that you follow our safety guidelines and those will be in the confirmation email that goes out as we get closer to the event. So Michelle, you might be able to answer this question. What happens if they test positive on the rapid test when moving in?
I'm going to pull up our email to make sure that I am quoting this specifically, but I believe that if students test positive when moving in, if they haven't already come to campus, then we're going to ask that they isolate at home and then move to campus. If you are on campus, then we'll move that student into one of our isolation spaces. And you can read more about this on our website as well as in that email.
So again, Michelle, this one's kind of directed at you. Are mental wellness activities such as meditation, yoga led regularly at each dorm, or do students need to seek them out?
So we have done programming in the residence halls in the past. We had a program called Mud Meditates that kind of cycled through. This year, because especially we're coming out of the pandemic still, we're going to be hiring students and really trying to bring programming to those spaces. But it's going to probably be something that's centrally located. That way, anyone who wants to opt in can. We definitely encourage students to interact with not just my office, the wellness office, but all of our student affairs offices, because we're constantly putting on programming and really hoping to reach the highest number of students.
I would also just add that our telehealth provider does offer online yoga and meditation and those resources as well. So when students sign up for that 7C health service, they have access to those as well.
Great. Someone's been asking about the COVID test form. Michelle, do you know if parents actually have access to that, or is that student access only?
I believe that they should have access to it. I think I tried to send it in the chat, but Erin, you might need to send it for everyone to have access to it. It's just a Google form.
I sent it and someone says they need permission. So can you just check the
okay.
permissions on it? Because sometimes they are the G.HMC restrictions, which is
Yeah.
your student has access, but parents do not.
I'm sure that they probably will want it to come from the student's account because that helps us track who sent it and how it came.
Right.
I actually don't have access to change permissions on the form. So I would just encourage students to sign into their HMCG email addresses when they're sending it in. I think it's really how they track it on the back end, which is why that's set that way.
Right. So all parents, ask your student to look at that, and hopefully it's a
But-
very clear process.
Yeah, and I can just like tell you right now, the only questions that it asks are your name, your residence hall, your student ID number, and then the proof of the date. So it's very brief. I think they were hoping to keep it that way so people filled it out.
They don't have to like upload a photo of the test.
They
or
do,
anything?
yeah.
Okay.
That's all that they need to do though, is just like residence hall, the move-in day, and their name in the photo.
Got it. So someone asked, can you go over using an antigen test to show COVID test results? And I believe you would take a photo of your antigen test and
Correct. And if they could put their name, they need to have their name and date visible. So whether they put their ID next to it, as well as like the written date that they took it,
got it.
just like on a post-it or something would work.
So someone is asking if a student does test positive during school, how does isolation happen on our campus? Especially with shared dorm rooms for first years.
Yeah, I can answer that question. So we're going to be doing it the same way that we've done it through the past year, which is that if a student tests positive for COVID-19, then we immediately move them into an isolation space. Some of those isolation spaces are on campus, some of them are on campus, but regardless of where the student is moved to, we do provide support. So we deliver meals, we deliver packages, we help them get medications, and they have access to what we call our Dean on call number. So if they have something that they need, they can like text or call our line and we can try to meet that need for them.
Great.
And then just to follow up, we do require that students isolate for the minimum of 5 days. They can take an antigen test after that, but if they do still test positive, then they're going to be required to isolate for the full 10 days.
Got it. So Pratik, you answered this in the Q&A, but I want to make sure our parents saw your answer. So just to confirm, even if a student has their own health insurance, they can be seen at the Student Health Service Center.
Yes, absolutely. That's, again, one of the biggest misconceptions out there. They can be seen at the Student Health Center. They can be seen at the Counseling Center, as Carrie mentioned, and there is no charge for the office visits to, just come in and see a provider and talk to a provider. If there are any additional services or procedures performed, tests that are done, medicines that are dispensed, injections given, etc., there will be some charges for that. But just to come in and see and talk to a provider, no, there's absolutely no charge. They can indeed be seen.
Great. And a little, and not related, but an additional question to you, Pratik. There is a 7C resource called the Queer Resource Center that our students have access to during their school year. And someone is asking whether it is open during the summer. They've been having trouble getting through.
Yeah, I don't directly oversee the QRC or the Queer Resource Center. My understanding is I think they are open, but my assumption would be that they were probably working remotely. So if you've been trying to get a hold of them via phone, you probably are not getting through. I believe their website has a email address, and that is probably the better way to try to get a hold of them. So I would try the email if you haven't done so already.
Great, thank you. So someone is asking about COVID isolation and how students keep up with classes. Do they Zoom in? Michelle, do you have details?
I do. It's going to be a little bit varied based on the professor and the class, but we do have a couple of academic deans who work with students who are in isolation to ensure that they're able to keep up with their classes. So that'll probably occur through meetings where they'll kind of work with the professor and the student to see how they can make up any information that they missed.
Right, and if you guys joined us last weekend for our academic overview with Marianne Delat, she talks about some of those academic dean services, and she would be part of that office that's contacted about making sure you're in contact with your professors about anything that's being missed. And whether Zoom is an option, I don't believe all of our professors are allowing Zoom ins for each class, but they are obviously understanding of people who are in isolation. So accommodations are very much on a personal basis for that kind of thing. All right, I think those are a lot of the questions. Oh, well, one came in about isolation again. So in isolation, can students still go outside alone with a mask to get exercise? I think the word isolation can be a little scary. So what are really our isolation policies?
So currently, we are not allowing students to leave the rooms during isolation. We're asking that they do stay isolated during that time. We understand that that can be really challenging, and we do encourage them to reach out for various supports. The primary reason for that is because we're a pretty densely populated campus, and for them to be going outside would mean touching doorknobs, walking through hallways, seeing people, and it's just kind of the nature of college that it's a highly social environment. And so we're just trying to protect everyone as much as possible, especially with these new variants that can be really virulent.
Great, thank you. Any other questions, parents? Please let us know. Are there any other links that we didn't get in the chat? I'm worried we missed some, but again, we will save the chat and send it to all the people here with any links and all the Q&A answers. Again, if there are any links in there, we will send those out as well. So someone's asking, will students need to bring masks, or will they be provided if they become needed?
We have KN95 masks in the Dean of Students office on our table right by the front door. They are also available down in the facilities office. And I'm sure the proctors will have, the proctors are like the residential advisors in the residence halls. And they generally have a supply, but yes, Harvey Mudd does have many masks on hand for student use, staff use, faculty use.
And I imagine SHS has it as well.
Correct. And while the campus can be mask friendly, LA County still has a requirement in certain spaces for masks to be required. That includes healthcare facilities. So student health and mental counseling both have a requirement for a mandatory indoor masking. So if a student does come to us without a mask, we do have masks, and they are required to still mask under LA County Health Officer order at student health and MCAPS. And I believe on campus, even the library, I believe, had a mask mandate. So there are still certain spaces that are just required to have masking. So always a better idea, even if it is mask friendly. Again, always better, safer. That's the one true way of really preventing COVID, right? Vaccinations, boosters, masking. Those are the most effective tools that we have. So I would still encourage your student to have masks and to wear masks.
Yes, and there are plenty of staff and faculty who still wear masks all day long around campus. So your student will not feel out of place if they are wearing a mask all the time. There will be plenty. And then someone's asking about masks cannot be cloth. And I believe the answer is our mask-friendly campus encourages surgical grade masks. However, I imagine most places are also any mask is better than no mask, except for potentially the health center. Pratik, you can correct me on that one.
Correct. No, I think you're absolutely spot on. So any masking is better than no masking. So cloth masks are okay. But certainly the better protection is with surgical grade masking or KN95 or N95 masking. And at the health center, certainly those would be the ones that would be required. And if they don't have one, we can give them one, and either they can double mask, wear it over their cloth mask or under it. or they can switch out their cloth mask for the one that we provide.
And then Kim, is there any restriction on the number of masks DSA will give you or FNM will give you?
No, we put them out on the table every day. We put out about 20 every morning, and there's usually still some there at the end of the day. We're not, I mean, students generally come in and just take one or two at a time.
Yeah.
And I think students just still, many of them have, those who want a mask already had their own supply. So this is really kind of in that case of, I don't have one and somebody's coughing around me or something, and I feel like I need that extra protection today or for this week, those type of situations. But I would still encourage your student to come with their supply of masks.
Yeah, everyone has a preference on how it fits your face. DSA and FNM have a specific type, and not all are always available. So if you prefer the flat ones or the things, I recommend bringing your preferred mask type for your face type. Someone is asking about the recordings. So I'm going to post the website where the recordings previous, this one will be posted. I will take this video and edit it and then post it, and as soon as I can, usually early in the week, and it'll be posted as a link on that website. So that is where you'll be able to find it. I think we've covered a lot this session, so I'm going to wrap it up. Thank you to our panelists, Kim, Pratik, Michelle, and Carrie. Thank you so much to our audience for your questions and for attending this event. Our Summer Welcome Series continues with 4 events next week. During the week, we have our sessions for first-generation families and international families. And then next Saturday, we have 2 back-to-back events, starting with our Parent Leadership Council panel, where we'll get to hear advice from current parents as to what it's really like at Harvey-Mudd College, and then followed by our event from the Division of Student Affairs office, kind of covering the large umbrella that office covers. So we are also currently hosting our series of regional summer welcome receptions. Those are all around the United States. A lot have passed. They look like they've been a lot of fun. And all that information on those sessions, as well as the recordings for these sessions, are in that link I just posted in chat. And then you can always find any additional information and helpful links at hmc.edu/parents. And then there's a family orientation 2022 sidebar item with more details. So thanks again for joining us. We hope to see you soon. Have a great rest of your weekend. Thanks, panelists.